and you looked right at me and you said, Kate, I look forward to taking really good care of you. And the moment you said that, I knew you were it for me. I want to introduce my fabulous guest for this podcast, who is Dr. Stephen Copp, who is an orthopedic surgeon and total joint specialist at Scripps Hospital in San Diego. I've had the privilege of knowing him professionally and personally, and did both my knee surgeries, and I can't tell you the difference he's made in my life. And the reason, not only is he a great diagnostician and technically a great surgeon, and is involved in research, is on the cutting edge, and is always making sure that he's doing the best thing for his patients. But the number one thing I love and adore about him and respect is that he cares. He cares about his patients. He sits and listens to his patients. He makes sure that he makes the best decision for them. It's their goals and what they want to do in their life that's important, not his. And I'm really grateful that you're going to get to hear what he has to say and hear about him as a person. He's a very unique and wonderful human being. I'm going to let you enjoy listening to Dr. Stephen Kopp. Hi. Hi, Kate. How are you? Thanks for coming. Sure, it's really nice for you to do this. I want everybody to know who Dr. Stephen Kopp is, because even if they're not the fortunate few that get to come to Scripps and see you, I just want people to know what really good medicine is, good decisions, good care. And there's nobody, in my opinion, as good as you in the total joint world.
I'm flattered, although there are plenty of people that are quite well in that type of stuff.
I've had professional and personal experience with you, but I started our joint effort to give people really good orthopedic medical advice. And because you, I'm sure, do the same thing. We take the history and when did you get hurt? Oh, 2 years ago, I went to this medical professional and they told you this, and I went to this therapist and I went to this and nothing helped. And I'm like, wait a minute, that's not how you treat that and not treat it well. And so they weren't getting a resolution to their problem. They're getting unnecessary procedures, irreversible surgeries, things like that. So I want to stop that. So part of that is interviewing the best people in their fields that I feel. So even if they're in another country and they need a total joint and they go to the doctor, they'll know what good questions to ask, what to expect, what's really good care and what's not, that kind of thing. And I'm so grateful you're here. Before we get into I want to know about where you went to school, why you picked this specialty and all that. You don't have to say any years.
Okay. Yeah, I'm not going to say years are too long ago. First of all, honored that you would think of me in that fashion. So I played ball first and that's basketball.
At San Diego State.
At San Diego State. And had planned at the time as a young person thinking that a professional athletic career would be terrific. Was injured my sophomore year and then lost that entire year, which is probably why I'm a physician, because then I got, oh, shucks, maybe I will not make it that far. Fortunately, had great fun playing ball and chased that for a few years after college and then stopped and pursued medicine, and then went to UCSD for medical school and then had the good fortune to stay in San Diego for residency. After that, joined Scripps Clinic and have been fortunate to work in one place for the last 38 years or so.
Wow.
Which is uncommon for many of the sort of higher level specialties, because when you leave someplace and go to work, residency is so much different than work that there's a lot of transition that has to occur. And I was fortunate. And the appeal of Scripps Clinic was the people that were there and the reputation and the things that are valuable for me in the sense of career, which the sort of 5 things that particular place does, which is quality care, research, education, philanthropy, outreach, and leadership. Those things. And then, I don't know, 25 years ago, I became the division head and then department chair to help to mold that ethic and continue to drive it forward. When I started, there were, I think, 6 of us, and now there's 27 orthopedists, 20 PAs, 6 podiatrists, 7 pain guys. It's become a very large department, and in that size, there is still that core ethic, and it starts with taking good care of people and doing the right thing, and which sounds a little sophomoric in the sense of its simplicity. The art of caring for someone is not always just based in your education. It has to be supported by that foundation. But the art of caring is the desire to do. And that's what we expect out of all the orthopedists that are there and anyone that's in the department.
It should have said this, you're an orthopedic surgeon, but and what's your area of specialty?
So I do total joints, which is a subspecialty that has arisen during my career from very limited numbers to now where much of the country experiences that for folks that have wear and tear on their joints, either from trauma or arthritis or occasionally some disease states that will cause a joint to be quite painful and limit their activity. So we get folks that are all the way from being in a wheelchair to walking in, but not able to sleep at night because of pain. And the luxuries of a joint surgery are that it actually restores someone. Much of medicine is often filled with the chronicities that we develop either from our lifestyle or from age, where you're trying to stop the effects of high blood pressure or you develop cardiac disease. You can't necessarily cure it. A great deal of orthopedics deals in the elective world, deals with pain, and we can take away pain and then actually bring people back to the functional level they are. That is an extraordinarily wonderful subspecialty to get to enjoy. I don't have to go look for folks. Thankfully, they come to find us, and then we meet them for 30 minutes, and then they allow us to do some crazy surgery. They come back and say thank you, actually pay you for it, which is just extraordinary. So, a good fortune to have chosen that early in my life to focus on as a career has been a blessing beyond belief.
You're really talented. Not only are you a great diagnostician, so that's to me, that's where it starts. You can do the best surgery in the world on the wrong patient, right? And
Yeah.
not have good outcomes, but you seem to figure it out each time. You make sure you do the right surgery, and technically you're fabulous, and that's why you get such good outcomes, and it's hard to get in to see you. The people that get to come see you, very fortunate, and if someone was from 10 states away and they wanted to see somebody like you, what would advice would you give them on, like, how would you find somebody like you?
Yeah. So there are some places that you can look on the web that are helpful. The Academy of American Academy of Orthopedic Surgeons, OS, has a website, www.aaos.org. And then another organization called ACUS, the Association of Hip and Knee Surgeons. That organization additionally sponsors websites, which for ACUS, the people that are members of AAHKS are hip and knee surgeons that do replacements and some other sophisticated surgeries around knees and hips that are helpful to resolve pain. Both of those websites would give someone at least exposure to folks that are usually doing that surgery at a relatively high volume. High volume is uh, helpful. It's not absolutely necessary. When we think of high volume, greater than 50 a year is at least a number that we know allows for folks to be familiar enough that the procedure they're doing is usually quite good. If there are, you have to depend somewhat on the person. If there's some unique circumstance where they would be uncomfortable or not wish to take on something more complex, then I would have the responsibility to refer someone. That's it. When we see someone, the idea is not that we're going to do an operation. It starts just with caring for someone. So, caring for someone that has arthritis or pain is looking for ways to control the pain so their lifestyle can be fulfilling. And we always talk about quality of life, which is like a box. in that box are relationships, a job, and activities, and your sort of life is in that box. When you get pain and disability, the box shrinks, and there's stuff that you would do or things. For an example, someone loved to play golf, and they had arthritis in hip joint, particularly the right-handed right hip joint. When they would go to swing and all the forces go through the right side, it would be painful. And if golf was really important to them and suddenly they couldn't play because it was hurtful, that means their quality of life box shrunk. And so when we're talking to someone, we aren't really doing anything more than interviewing them. Ask me, well, what's your life like? What's going on? Do you feel good about where you are? And if people say with arthritis, because arthritis is not cancer or heart disease, so it's not like you have to do something. If they say, no, I'm okay. All right. And you're okay. There's no reason for me to promote doing something, whether it's medications or anything else, if people are okay. They just need to know what they have. Sometimes that's just education. They're comfortable. No, me hurts a little bit, but I'm fine. And then you get the other end of the thing. No, I can't sleep at night. I can't go up and down stairs. I can only walk a block. Yeah, then it's important to try to help expand that life. That could be just taking an anti-inflammatory, and that'll be enough. Could be an injection. It doesn't have to be surgery. Surgery exists as a skill set that we own, but it's applied only when there's nothing else left and someone's quality of life is compromised. And then it merits the risk because it's not free. It's like surgery is like a fence with barbed wire on. And if you're on one side of the fence, you got to get over the fence to the other side. Now, the grass may be greener over there, but going over the barbed wire is not so much fun. And so it is unique in surgery in general. We're going to hurt someone to try to help them. And in that, we're going to expose them to risk, anesthesia, all kinds of things. So you want to be pretty thoughtful about doing it. We do it a lot, but it's still every time you're trying to think, is that the right thing?
See, that's what I love about you. You do the right thing. You answered my question that a lot of patients have asked me is like, how do I know when I need one? You just said you compromise your quality of life enough.
Yeah, in the office, sometimes I'll say to someone who's very unprofessional, but I said, if you get to the point that life sucks, then fix it. Everybody understands. Oh, yeah, I got it. And some people, that's fine. And it is completely different for someone that's very athletic and that's part of their life. Someone that's very sedentary. They're two different people. You're not treating a box. You're treating humans, and each one of them is unique. And I'm not exactly a chatty person usually. The fact that I get to talk to someone one on one is incredibly fulfilling. Because if I were out in the world, I probably wouldn't talk to anyone. Was as for medicine, I would probably be in the lab somewhere working on what is saying small animals.
The other thing you do, there's a lot of parts to surgery besides picking the right patient. And there's the components and et cetera. And I also know you're involved in research. So you're always, it seems, searching for the best way to do things or what. So can you talk a little bit about what you do research wise or
So research has obviously changed over my entire career, but the department that I'm in or managed for quite a while has two areas of research. One is called clinical, which usually runs through what are called fellows or graduate medical education. We teach young gals and men that have finished their residency but are going to have another year of specialty training. So there's 4 fellows in joint reconstruction, there's 3 in spine, there's 3 in sports. So all of those people, we ask of them that they do a clinical project. So usually something that would further our ability to care for people well. And then there's the basic science lab. The clinical stuff, probably about $1 million a year of our funds that we dedicate to that. The basic science lab and historically used to start as biomechanics, where we were actually looking at implants, evaluating implants, looking at an implant design. We still do some of that, mostly for shoulders, less so for hips and knees now. And then it morphed into trying to think about, can you do something different than an operation to take care of someone that has arthritis? grants and things that have stimulated stem cell research and the present projects. One looking at rotator cuff to try to see if there's a pathway for us to improve either repair and or do some other augmented repair with stem cells that would be advantageous for a long-term outcome for that particular problem. Looking at menisci, being able to what we call spin a meniscus, which is use some fancy polyglycolic acid stuff to spin a meniscus in its shape and then populate it with stem cells and be able to have an off-the-shelf product that would replace someone's meniscus if it were torn. And then in rabbits and sheep, we've done work where we've made cartilage injuries and fixed the injuries either with what's called bioprinting or with structured cell matrices that we have made and put in. Works pretty well, and we aren't quite to humans yet. And this cartilage is pretty unique. And for people to know, cartilage is the stuff that if it goes away, then you have arthritis. So if we could figure out how to fix it, yeah, be really cool. Whether the fantasy is being able to inject something inside a knee joint that has arthritis and magically, woof, it would be better. That's playing God, and the closer you get to that, the harder it is. So we've done pretty well with rabbits and sheep, but we're not quite to humans yet.
When I was about to have my total knees, I went to 3 different orthopedic surgeons. You were the 3rd. Now, does that order didn't matter. It took me the longest to get in to see you.
Have to be in third place, but I'll take it. It's better than last.
And I asked a lot of tough questions, like I had a lot of valgus or knock knee, and how are you going to fix that? And maybe some more questions, or maybe someone who didn't look in the field would know. And you answered all my questions. I, of course, liked you right from the start. I'd known you before, and but I'll tell you, and I want people to. I've never had a doctor say this to me. You first of all, you sat down like you had all the time in the world, and you listened to me, and we talked about my options and where I had suffered with this for my whole life, and I was in horrible knee pain for since I was 13 years old.
Yeah.
And had 10 now I've had 10 surgeries.
Yeah. You had some unique surgeries done.
Yeah, cats. And you did the last 2, which that's it. You fixed them, I'm all fine. But we got all done, and you stood up, and you went to walk to the door, and you turned around, and you looked right at me, and you said, "Kate, I look forward to taking really good care of you." And the moment you said that, I knew you were it for me. And you're it for everybody else I've sent to you. And I've never had anybody say that to me. And so as a patient, that means a lot. And I don't know where that comes from with you because it's unique.
Yeah. So I look at it from the patient's perspective, I guess. First of all, it's incredibly threatening to go to an orthopedic surgeon because what you hear about orthopedic surgeons is one, not necessarily compassionate. And I understand why. We deal with pain all the time. So we're owning part of that pain. And occasionally folks put up a shield so they don't have the pain rest with them all the time. But more importantly, giving a patient power is really important because the relationship is pretty asymmetric. I'm retaining knowledge and skill, and often the person on the other side doesn't have much of that. And to try to get them to understand that they aren't in a powerless position, they are capable of asking them. Part of that is just telling them that it's a privilege to care for them. Because if you don't, it can feel very intimidating. I've been on the side periodically prior to becoming an orthopedist, and I can remember what it was like. This person walked in and said, "You'll be fine," and didn't tell me anything else. And I was like, "What?" And then somebody else said, "Oh yeah, you're healed," and then turns out it wasn't. And I had no grasp on any aspect of what was occurring anatomically, biologically, or anything. I was really privileged to have a brain that worked, but in that environment, I was just lost. And to try to make sure the relationship calms and gets to the point that you can have people talk. It's important to stand there and say, tell me more. What else? And to allow folks to express themselves. And then to try to educate them at the same time. Because if you don't, it's not, it doesn't feel comfortable to me. And plus, when surgery, not every surgery goes well, I want them to know that no matter what, I'm going to work to care for them. And when we talk about risks, everybody thinks they're not going to be the one, but somebody's the one. And so when we talk about the poor outcome or something that's happened, to make sure they know that I'm going to sit there and educate them and talk about all that stuff, be in their corner. If they want another opinion, figure out how to get it for them. Those are important because to be powerless is incredibly threatening for a human.
Yeah, I never thought about it that way, but for people who are outside your area and I've always said to them, not only do they have to have great credentials, but you as a patient have to feel like they're going to take good care of you, good, bad, or ugly, no matter what. And that you feel like, and so I had a pretty big complication after both of my surgeries and this huge inflammation. I thought you left something like you left a sponge in there or something. Something's not right. It's terrible. And go to the ER and all this stuff. And I remember going to see you, and you were very calmly said, "This is a reaction, unfortunately, in younger people, and this is how we're going to fix it." And instead of being frantic like I was before I saw you, I was certain that it was going to get better. And you made me feel that way. And so I think that's again another gift that I see in you, that it's a unique, very unique.
Yeah, I don't know, about uniqueness. I just know that for caring for others, it's just leaning in all the time.
Yeah.
And whether that's being firm, sometimes being compassionate, there's all different kinds of things that happen in that relationship. When I talk to people about when they're asking about who to see or who to take care of them, and I was like, listen, most of the time, surgery goes well. For the stuff we're dealing with, 95% of knees are good and 98% of hips are good. You could hate the surgeon and it'd probably turn out fine. You need to have a positive relationship when things are hard. For sure. Either complication or it's a slower recovery, something that allows you to feel that they're working hard to help you.
Yeah. And I think as a patient, I'm sure people get a sense of that when they meet someone.
I think so.
I've heard people say, "Oh, you didn't spend much time with me," or "It's in and out," or "I saw an assistant," or whatever. And then, but oh, this guy said that even if it was 5 more minutes, it makes the difference.
It does. And that all of us as humans feel connection periodically. If that happens with a surgeon person, no matter the subspecialty, it could be a general surgeon, the ENT doc, whatever the problem is, that connection is incredibly valuable.
So, for somebody who is considering having a total joint surgery and they're not in our area, if you could just tell them what would be a couple things you would say to people that are the most important things in making this decision of A, having surgery, and B, who the best person is there, what most important things?
Most important thing for the surgeon is one, feeling some connection and knowing that their reputation and or with them is that they do this surgery relatively frequently, so it's not foreign to them. And then after that, for knees, the most important thing is that people are prepared to lean in to what they need to do. Because a knee replacement, surgery doesn't take long, an hour, but the recovery is miserable. And it requires the personal effort of the patient to get the outcome that they want and we want for you. And if they're not prepared to lean into therapy, then the outcome will be poor. For a hip replacement, they just need to find a good surgeon and somebody they trust, and then just tell them, do the right thing, and they'll do fine.
Yeah, perfect. Yeah, it's knee after total knee physical therapy is not for wimps. I would say it's
No, it is
rough.
not.
Gotta be committed.
Because it hurts. And then in spite of the fact that it hurts, we're telling people, oh, you have to bend it. Occasionally we get folks that walk in a month and like, Well, back, it's fine. Just wiggle their leg around, and you're just like, oh, how did that happen? But most of the time, it requires a fair bit of effort. And, you don't sleep well for a month. And then it finally starts to get better. And it's Groundhog Day. Every day you wake up in the morning and it's stiff and feels like somebody poured cement in it overnight. And it's frustrating and hard. And if you're prepared for that, and you should do really well.
Knowing what going in is important.
And you have to, and if a surgeon says to you, oh, no, it'll be easy, then you probably want to get it. Another surgeons.
Good point.
Because that makes me feel like they're selling the surgery. And that should be the last thing.
Is there something about what you do or how you do it that I haven't asked you or you'd like people to know?
No, I don't think so. Surgery is, for those of us that have been trained to do it, it's incredibly fulfilling. It is really hard when you first start to take a knife and cut someone open. And the, it's hard for folks to understand. For me, a newly minted orthopedist is 14 years after high school. And then a good orthopedist is another 5 years after that. So you're talking 20 years of investment for a surgeon. Doesn't matter the subspecialty orthopedics had to be money, but any one of the subspecialties of surgery requires substantial effort to do it well. So if you see someone and, they do merit some respect, but they also merit that they listen to you. I didn't ask you about your stuff, so I've tried to leave out asking you about how'd you meet him?
Oh, great. By both of them. Both my knees are great, thanks to you and all the rehab I did, but
Yeah. Thanks to your team of rehab.
yeah, it's since we did my first one was in 2018, and then 2020. Even with that complication, I went back for more. I'm a
Your knees look like somebody ran track on them.
Yeah, they were I think they're still the worst extras I've ever seen, but
They are pretty.
yeah, it like you said, took so much effort, and I'm so happy they don't hurt at all, and for to have knee pain my entire life,
Yeah,
not is so different.
yeah. So when I saw you a year after your second one, I would have said you were 3 or 4 years younger, just because your face was smooth, not smooth.
Oh, interesting. Huh.
Yeah, occasionally one of the things that we talk about is that when someone's in a fair bit of pain, they'll come back on this now. They're doing that stuff. And I go, yeah, everybody thinks I look younger.
Interesting. Now I never thought yeah, pain in your face is not a good look. I was one of our mutual friends and patients. She did her total knees too, and she did a video with me. And when I said to her that after I played tennis in college, and after every tennis match, I had to go home and ice my knees. They got big and swollen and painful. Take anti-inflammatories. That was like my routine.
And you thought it was normal.
Yeah, for my knees, yeah. But to not have to do that and have that pain, I don't know if I can even explain it, but
Yeah, you get to it, particularly athletic folks get accustomed to pain. Like the first time I had my labrum fixed, and I went back to work the next day, and I'm like, huh, didn't hurt that much. To me, it didn't hurt that much. And I'm like, oh, shoot, I would have played with this. And then you start to realize how much athletics asks of you to tolerate musculoskeletal discomfort. Because I'm like, oh, I've done this surgery before. I gave people pain medicine for it. I'm like, that's fine. And so, every person, the way they are raised or the experiences they have colors how they think of the discomfort. So you lived with pain because it was normal. You did it for 40 years.
yeah, a long time, way too long. Of course, we did it at a time where I'm thinking it'll last my lifetime, so I won't ever have to.
Yeah, 25 years.
Yeah,
We're going to
maybe I'll live a few more years. Oh no, we'll see.
Okay.
But if people want to read about you, find out about you, would they go to Scripps?
Yeah, they would go to www.scripps.org, or they could just Google my name and it'll come up. Don't look at the basketball stars.
Stephen, COPP. And that hopefully they'll at least be able to
I can help direct them if
education and get inspired with, yes, I can find the best guy and or gal or whatever it is.
sure. Happy to do.
Thank you again. I can't tell you what a difference you've made in my life. And I want everybody to have that experience if they can.
Yeah, it's a privilege to care for someone, and for caring for you is even more.